Good evening, good afternoon, and good morning to colleagues joining us from across the globe. Welcome to this webinar. I would like to open with a line of Sir William Osler that medicine is a science of uncertainty and an art of probability. And it is a framework, theoretical and conceptual, that help us manage that uncertainty in our research. This is exactly what this session is equipped with you. Our speaker is Professor Mohammad Shahid Shamim, Associate Dean for Graduate Studies and a Professor of Medical Education at Aga Khan University, Karachi. He's a Fellow for Royal College of Physicians and Surgeons, Glasgow, and holds a PhD in Medical Education from the University of Sydney. And he's a Senior Fellow of Higher Education Academy. He served as an assessor for World Medical Federation for Medical Education and as an international advisor to the Royal College of Physicians and Surgeons of Glasgow. But what makes Professor Shamim uniquely qualified to lead this session is that he does not just teach about the frameworks, he builds them. His contextually relevant ethics education model, published by Springer, combined multiple learning theories to create a novel approach to ethics education across the diverse cultural settings. His systematic review in the Journal of Pakistan Medical Association demonstrated that reflection grounded in social constructivist and experiential theory is most effective pathway for developing ethical attributes in medical learners. His qualitative study in the BMC medical education used explorative conceptual framework to develop and refine a contextually relevant ethics education strategy, a direct example of very skill that we are going to learn in this webinar. And the most recent in 2024 paper proposed a conceptual framework for the practical ethics of prescribing, addressing the social, political, and economics dimensions that traditionally medical educations overlook. With over 60 peers review publications, 2 authors' books on bioethics, and more than 200 faculty development workshops delivered across Asia, Africa, and Europe, Professor Shamim brings both scholarship and live experience to applying frameworks to the real-world health professional education challenges. It's our privilege to learn from Professor Shamim. The floor is yours.
Thank you, Dr. Hussain. Thank you, really. Thank you very much for those very kind words and such an elaborated introduction. I don't know if I'm worthy of it or not, but I hope the audience would be satisfied with what. In fact, it's not about teaching actually. It's about learning together. Well, such topics like the one we will be talking about today are not something that we can teach and learn each other. It's more like doing and learning with each other rather than to each other. So I think there are about 23 participants, including all of us, the organizers and myself. So maybe we shall start, and
Yes, sir.
we can keep joining in. Okay. So as Sakina mentioned, that it would be great if you guys can, the audience, that the people, participants can actually keep it interactive and just say out whatever you feel like, whatever comes to your mind. You want to discuss a concept, you want to share an experience. Please feel free to raise your hand or just open your mic and interrupt in between. It would be lovely if we can have it both ways. Secondly, if it is possible for those who are ready for it, and they can have their cameras open at least when they're speaking, or even in between also. It feels good to talk to people rather than just to a screen with the name on it. So yeah, it gives me motivation to talk to you also. I have requested Dr. Hussain to keep an eye on the chat because while I'm seeing my screen, the presentation and all, it's not possible to look at this chat all the time. But if you have a question, if you have comment, please feel free to say it out loud.
Sure, sir.
All right. So today's topic is using theoretical and conceptual framework in health professional education research. And Dr. Hussain said some really nice things about why I am the right person for taking this webinar. I hope I come up to your expectations, but you know, the topic is not something that anybody can say that I have full command on it. It's a really complex, complicated topic, and even after talking about it multiple times, writing about it, it every time I go to it and I'm reading a new article or something, it feels that no, there are things that we need to learn more. But the only way to understand it is by doing it and by using frameworks in your research. So what essentially is a framework? Framework is a supporting structure. It's a common English word, which structure that is used for building vehicle or objects or buildings. Uh, it is also defined as a basic structure underlying a system, concept, or even text. You know, people who author books, they also develop a framework first before constructing their or putting their thoughts into those areas of different areas within the framework. Cambridge Dictionary defines it as a supporting structure around which something can be built. Again, same meaning in different words. So basically, it's the framework. It's the basic foundation and structure, basic structure around which something is developed. So how does it fit into health professional education research? So frameworks are not abstract academic exercises. A lot of times people, after conducting the whole research, and when they are writing their paper, they come to me and they ask me that, you know, this is my research, this is my paper, and I was thinking of using a theoretical or a conceptual framework into it so that the article looks good. Now, that is not the right way to do it, because frameworks are not academic exercises or a to-do list. These are essential for laying a foundation for your study, for your research. This is where your research will meaningfully emerge from. This is where it should actually begin from. These framework, they provide structure and credibility to a research. And not only that, it actually helps others to evaluate your research. Once you have a framework, once you have a structure, when you send that article or a thesis to the reviewers, they have a foundation, a baseline to review your work and critically analyze it, critically evaluate it. So there are two commonly used frameworks in health professional education research. And these are the definitions. Theoretical framework, it is defined as something which is based on existing pre-established theories. It guides research with a solid foundation based on existing literature. And conceptual framework, which is something that is constructed from various concepts, experiences, models, theories, etc., guides your study variables and their relationships in the forward direction. All right? Understood or not?
Yes, sir. There are no questions from the audience at the moment.
All right. So yes, these are confusing definitions because the word theory is used repeatedly in different forms and different meanings. Many times we get confused in which framework should be doing what, how should we develop a conceptual framework. When a conceptual framework also includes theory, then how is it different from a theoretical framework? And if the theoretical framework is something which is explaining my concepts, then why is it not the conceptual framework? So there are so many questions asked, and it is something which keeps people confused and struggling. Is there a question, Hussain sir?
No, sir. No question at the moment.
All right. Okay. So this confusion is what we will try to amend, we'll try to alleviate by the end of this webinar in the next 40 minutes or 45 minutes. And the outline of this webinar is this. We'll be talking about terminologies. We will unpack what is a theory, what is a theoretical framework, and what is a conceptual framework. We will see how the two distinguish from each other, and then we will try to apply them in health professional education research. I have made some examples to show you applications, but it would be more interesting if by the end of that, you can come up with your research questions or your research ideas, and we can together try to use or develop a conceptual framework and theoretical frameworks for your research. Okay, so keep that in mind when you're listening to it. Think about something that you have started doing, or think about something that you plan to do in research, and then we can actually use that as a case, and then we can work on it. So what is a theory? A theory is defined as a structured set of ideas or principles designed to explain, predict, or understand a phenomenon. This is one of the many definitions that you can find on the websites, in literature, in books, and everywhere. So basically, it's a structured set of ideas or principles which explain or predict or understand or make us understand a phenomena or a complex concept. Okay. The problem is that in everyday language, we use this word theory in so many different ways. For example, we use it for as a speculative hunch or conjecture, like explaining an idea or a guess or an assumption, without even having any testing done on that. For example, my theory, this is statement which is seen on the screen, that my theory is students learn best if they sit in the front row. Or my theory is that if I get up early in the morning, I can do more work by afternoon, or something like that. Or one of the theories is that if people who take good heavy breakfast in the morning, they are more productive during the day. So these are theories which are actually speculations. These are speculative theories or speculations or opinions of people which are not backed by any evidence or not backed by any scientific research, right? In medicine, we use a lot of times we use such theories. Like someone may say that, I have a theory that stress alone can cause ulcers without any. I can say, well, okay, I have a theory that people who eat bananas are more likely to have appendicitis, acute appendicitis, right? Maybe because I saw 10 patients who were eating bananas when they came in with a pain in the right iliac fossa. So these are assumptions, these are speculations, but we often use the word theory with them. Another way that we use theory is when we are talking about scientific theories. Now, scientific theories are well-established, well-substantiated explanations, tested and supported by evidence, right? For example, cognitive constructive learning theory or cognitive load theory, or in medicine, we have germ theory for diseases, for infection, for microorganism causing infections and stuff like that. So these are theories which are well explained, tested, proven with published evidence, right? When we are doing research, the word theory is used in different ways in different places. Another example is grounded theory approach. In grounded theory approach, when we are conducting, suppose, interviews or focus group discussions, and we are getting data, and we say that, okay, we have taken a grounded theory approach, and we will develop theory from our data, or we are building theory, constructing theory from our data. This theory is not the scientific theory that we are talking about here now, which is a substantiated, explained, tested phenomenon, or evidence proven thing, right? So when I use the word theory here for applying in a theoretical framework, I am talking about the scientific theories. I'm talking about theories that are established, explained, and evidence proven and published, right? And between these two types of theories, the scientific theories and the speculations or speculative theories or guesses or assumptions, there is a yellow area which says abstract principles. Now, these abstract principles or concepts or ideas that we develop or we generate in our minds from our understanding of scientific theories and our experiences and speculations. And when we are planning our research, these abstract principles or abstract concepts play a major role. What major role do they play? They help us in developing our conceptual framework. Are you with me? It would be great if you guys can show a thumbs up or something, or
So there are two questions from the audience.
oh, wonderful. Okay,
Uh, so
let
yeah, so Mr. Ibrahim has asked that how can we differentiate between theory, assumption, and hypothesis?
okay. So basically, I am. This is a very good question. Okay, but keep this for the end. Differentiate between theory, assumptions, and
And
hypothesis.
the hypothesis, yeah.
Yeah.
And I
So
think, sorry, so there's another audience from question from the audience. Yogesh have the same sort of question. He is asking hypothesis or assumptions will be better word that using the word theory without research. I think this
okay.
is
So in a very if I quickly try to answer this question, because the reason I deliberately did not go into the hypothesis part, because that is another a very large area that we can get confused into. The purpose of explaining the word theory here was because when we will be using it in our theoretical framework, which type of theory are we, or in which meaning are we using this? That was the purpose. But as somebody has asked, when we talk about hypotheses are concepts or ideas or abstract principles, abstract ideas. You see this yellow center point between speculation and between speculation and scientific theory. This is where hypothesis develop. Hypothesis is before a hypothesis is tested or researched upon, it is still a not proven, not tested opinion or an idea. So in quantitative research, hypotheses are the basic conceptual research question equivalent thing in quantitative research. So we here are talking about health professional education research, which is more of social sciences, more of not a hard science thing. So we'll probably be talking more about concepts than hypothesis. But in terms of doing research, a scientific theory. Now, as I said earlier, the word theory is used in many ways. You may say that this is my theory, and based on my theory, this is my hypothesis. There's nothing wrong in this sentence. I'll say it again. Based on my theory, this is my hypothesis for my study, right? But when you're using the word theory here, it does not mean scientific theory or proven established theory. You're talking about your assumptions based on uh, experiences, based on what you have understood from other theories, other established theories and stuff, right? And that's how assumptions or hypotheses are differentiated from scientific theory. right? Does it answer the question? Okay, so let's
I will.
move.
Yeah, sure.
Okay, let's move forward. So let's see what is a conceptual framework, and then we will come to the theoretical framework. Okay, and then we'll try to see how the both of them, how they interact with each other in our research. Conceptual framework is something that comes uh, constructed from various concepts, experiences, models, and theory. As I was trying to answer the question, and I was saying that these ideas and abstract concepts that are used to create a research idea are those which actually take you to your conceptual framework. And the conceptual framework is then around which your research is developing. So this framework guides the study design, not only uh, uh, the design, but coming back from the research question. So we'll have an example of this. So conceptual framework will come out from your research idea, from the abstract concepts that you had. And then based on your framework, your research question will develop, your study design will develop, and your data collection analysis methods will develop. Okay. And how does it happen? You have to answer this question. Once you have an idea, for research, you ask yourself, what are the main elements which can be connected with this idea or with this concept, and how do they relate to each other? Okay, let's see an example. And when we see an example, I think it will be more clear. For example, I think of a topic for research. Say, for example, the impact of medical school learning on patient care. Okay, is it a doable idea or a researchable idea? Okay. So I'll ask myself, what are the main concepts or what are the elements that can be related to this idea? Educational inputs, uh, clinical behavior, competence development, competencies development, contextual factors, like for example, where is the medical school, patient outcomes. So these are a few things that come to my mind when I think about doing a research, something to do on seeing the impact of medical school learning on patient care. Okay, are you with me?
Yes, sir. Audience
Yes,
are
sir.
following. Yeah.
Okay. So let's work with some of these ideas. So now you see, I had an idea, I had a topic, and I started developing my conceptual framework. For that, I thought of what are the main elements or main concepts that goes around this idea on which I want to do research. Okay, and then I take it forward, and with each of them, I start thinking of, okay, what are other things that can be related to this? For example, uh, educational inputs. When I think of educational inputs, I'm thinking about curriculum, teaching methods, assessment, right? When I think of educational inputs being used for competency development, I think of, okay, medical knowledge can be there, professionalism, clinical skills. And these are examples, okay, that you can think of a lot more things, but I had limited space on my screen, so I've used a few, okay? You can do this on a big whiteboard or a blackboard or a chart paper or something. And then competency development takes on to clinical behavior and patient outcomes. And contextual factors also play their role somewhere, like student factors, system factors, social cultural factors. Okay. And when we talk about patient outcome, they can be clinical outcomes of patients, they can be patient satisfaction. All right. This is a big board of things. And again, the elements coming out from one main idea can also be interconnected with each other. For example, professionalism can also affect patient satisfaction, or assessment can be influenced by student factors, or system factors can affect assessment, and so on and so forth. And then you see there are arrows with arrowheads going in one direction or the other, and there are some lines without arrows. So these are the relationships that you can think about, that okay, how, for example, how does curriculum interact with medical knowledge? Is it a causal relationship? Is it a two-way relationship? Is medical knowledge dependent on curriculum, or is curriculum dependent on something else? Similarly, you can think about how, for example, patient satisfaction combines or relates to social culture factors. Is the level of satisfaction different in different social groups or countries, or different parts of the country? So these are relationships of different elements with each other. Now, we are not going into the detail of that. What we are trying to do is develop a conceptual framework for our research. And we still do not have a research question. We just have a topic of research. So if I want to develop a research question at this level, I need to make sure that I choose the elements which fit to my idea of research or my research question. So if I say think of doing educational input, relationship between educational input and patient outcome, I take that as the main idea, and I try to develop a research question around it. The topic remains the same. The research question will be developed for seeing how educational inputs would impact patient care or patient outcomes. Right? Are you with me?
Yes.
So now we are developing the conceptual framework precisely or specific to our research. And by this time, your research question would come up as clearly, and you can think about developing a research question and see, say, for example, a research question can be, what are the effects of uh, curriculum and teaching methods and assessment on patient outcome, and remove everything else from there. Or you can think about how does educational environment affect patient satisfaction, and you can remove all the other things around it. So that will form a conceptual framework for your research question. Am I making sense? Okay. Suppose you want to bring in clinical behavior. Your research now, just bringing in clinical behavior in the framework, your research question will get changed. Right? Now you can have maybe one or maybe more than one research questions. Your research question may include social factors now. Your connections may change. You may want to connect clinical skills with clinical behavior. So this diagram would help you in understanding your own research question, refine it, and then think about, all right, to get to this outcome or this end, what means I need, which study design or which data collection methods would be best for getting to this research question or answering this research question. Another example, maybe you want to see competence development, because the topic remains the same, the impact of medical school learning on patient care, and competencies can play a major role in that. So your research idea gets more refined through your conceptual framework. And then when your research idea gets refined, your research question gets refined. And you come to a research question which makes sense to you, which makes sense to your idea, and which makes sense on this conceptual framework by showing different relations with different elements of your idea, within your idea. Does it make sense?
Yes, sir.
So you
And there is
see,
a question. Sorry,
yeah.
should I put a question or do you want to continue?
Let me see the chat. Maybe you can just read the question.
Yeah. So there is a question from Afros. Should the conceptual framework based on any theory? Is this necessary?
Okay. So, Afroz, as I said earlier, that conceptual frameworks do not require a pre-established theory at this point in time. A conceptual framework at this point in time is based, it is very specific to your idea, your research. It's, up till now, we have not gone into established theories. We are only talking about abstract concepts, your ideas, your topic of research, coming from your experiences, from your reading of theories, maybe, yes, but we are not using any theory till now, right? Because this is your research question. You have to develop an idea for your research. Okay? And we'll come to the point where theory will come into your conceptual framework. All right? So this was the big board, big whiteboard or blackboard on which we were making this drawing. And you see, from this, we can find different ideas or different research questions, and multiple researches can come out of it. So if any of you are working on a research thesis for a master's or a PhD, then you may not reduce it to one line or two or three elements. You may want to study the whole whiteboard for your thesis, for your research thesis. And you can have different phases and different areas of within your conceptual framework, right? So what does conceptual framework do? It provides a structure to your research. It provides a framework on which you develop your research. You build up your research idea into a research question, refine it, and then once it is refined, it can guide you for your research design, your data collection method, and the way you're going to analyze it to come to the outcome of your research that you planned in your initial thought. Are you guys with me? Or have I confused you even more? Okay, great, lovely. Ibrahim Saab, your thumbs up is very supportive for me. Thank you. All right. So now let's see. So this is about conceptual framework, and we'll come back to it again when we are concluding it and putting everything all together. Now, let's see where the theoretical framework fits in this scenario. A theoretical framework is something that you think about after you have developed your research idea, right? The question that was asked by, I think, Faizan Saab or someone. So before you start thinking about your, before you move on to the next level, and it is usually, some people think about a theoretical framework at the beginning of when they are developing their research idea, and after they have developed a conceptual framework, they start thinking about a theoretical framework or theory that can be related to the research idea. But at times you may change that once you have the data and everything collected, because now what you're doing, you want to think about what others have already done in this area, what theories they have already developed in this area where my research idea is developing. This is where you go to literature, right? And you see what others have already done in this, and what theories and ideas are already there, which can actually explain your research idea. So you need to look at what others have said about the concepts that you're building on, the theories they have presented, and how they relate to your area, your research. Not just your research question, but also your research data and how your research findings are unfolding. So even if you already have decided or already have a theory in your mind, you may review it, you may revisit it, you may change it, modify it once your data is collected, once you are analyzing and you have analyzed your data and you're writing your inferences or results. Because this is when your work is unfolding. And now the way it is unfolding, you would want to know, okay, which theories or which researchers have already worked on this and how their work relates to my work. Are there theories explaining what my findings are, or is there more to it? So, as I said earlier, a theory is an idea about how something works. It's a way of explaining patterns, experiences, behavior, social pressures. So you will probably come up with several theories for your research, and you will evaluate them, judge them, figure out which of them is more relevant to your research question, or maybe there are more than one theory, more theories than one, which are relevant to your research question. Right. So a theory is an idea about how something works. Theoretical framework is based on these pre-existing, pre-established theories and models. They guide your research with a solid foundation based on existing literature. Now, they are not guiding the development of your research, right? When you're writing a proposal, when you're writing a research proposal, or you're just thinking about your research, developing a research idea, at that point also you think about a theory or a theoretical framework. But that may not be your final theoretical framework. That is something you think may, and that also after your research question is developed and you have decided how you are going to perform your or conduct your research. At this point, when you're writing a proposal, whatever theoretical framework or whatever theories you think are engaging with your or helping you understand your research may not be the same by the end of your study. So there's nothing wrong if your theoretical framework gets modified over a period of time while you have conducted your study. So when you're deciding your final theoretical framework, you answer this question: which of the existing theory or theories can help understand my topic of research or can help understand my research? So if you're doing this for your proposal, you can say, okay, which of the existing theories can help understand my topic of research? When you're doing this at the end of your research, when you're writing your discussion, or when you're trying to understand or elaborate on your study results, you can say, okay, which of the existing theory or theories can help understand my research results, my research, how I've conducted it. Are you with me? Okay, let's see how it fits with the conceptual framework. So remember, this was our conceptual framework, and the topic was the impact of medical school learning on patient care. Now, which theories, which obviously we'll talk about education theories. So which education theories may be the best to explain our research on this topic? And no, we came up with different research questions. We talked about different frameworks. So obviously, as the framework would change, as the research question would change, the theory, theoretical framework or the theory which will be forming the theoretical framework will also change. So can we use adult learning theory? Adults are motivated by relevance, internal drives, and need to solve problems. In our framework, can we put this for one of the research questions that we develop? Or social constructivism. Knowledge and reality are actively constructed through social interaction and cultural contexts. Experiential learning theory. Learners gain knowledge and skills through direct hands-on experience other than just passive instructions. Situated learning theory. Theory of planned behavior. So each of these theories, although they seem to be related to the topic, the impact of medical school learning on patient care. They are related to medical school teaching and learning. They are related to uh, outcome of healthcare delivery, patient care, but they all have their different focuses. And depending on which path we take or which research uh, uh, angle we take, what research question we develop, the theory will change. Can you see that on this slide? So when we talked about, for example, educational outputs and patient outcomes, right? Or we talked about competency development with educational output and patient outcome, the theory will change. If we talk about contextual factors coming in action with one of these, the theory can change because the research question would change. So depending on your research question, you will select the most relevant theory or theories to develop your theoretical framework. And in this way, the theoretical framework provides a comprehensive view of your research. Any questions? Any comments?
Yes, sir, there are a lot of questions I'm getting on the chat box. So I would go with the Nirmal's question. She was asking that is the conceptual framework is similar to the logical model?
Sorry, come again. Is a conceptual framework similar to?
Logic model.
Okay, so logic model is one of the models that can be used in your conceptual in your theoretical framework. A conceptual framework, see, this is one of the fundamental problems because when previously also somebody asked that conceptual framework, where does theory fit in conceptual framework? See, the conceptual framework is your idea developing into a framework, your concepts developing into a framework. You may use theories or models from other perspectives, from other people to build up your own idea, but they should not be the primary focus or the primary input into your conceptual framework. The conceptual framework is something that is very personal to your research. And that is what the reviewer would want to see. We talk about significance of a study, rationale behind the study. These things come from your conceptual framework because these are personal to your idea, your research. Logic theory or logic model can be applied as a theoretical framework if your research questions aligns with it, or it can be used as an added model based on which you develop your assumptions and your concepts, and then you develop your conceptual model. Am I making sense?
Yes, she has replied. She has got her answer.
All right, great, lovely. Okay. When I try to see the chat, I my screen changes. All right, so this is one of the activities that you can do with your study or research idea. Think of a research topic, right? Ask yourself, what is your research topic? What is the area that you want to do research in? And then narrow it down to a research question. Okay, first write the idea or a broader idea, and then narrow it down in a research question and write it as a research question if you can. Or you can directly jump to writing concepts and elements central to your research idea. And then come back to the research question and refine it if you have written before, or not. If you have not written before, you can write it then, right? So write a research topic. So we don't have time for this. Otherwise, I was thinking that if there's time, maybe we can do this, but we are already we have hardly 10-15 minutes. So this is something that you can do on your own time, and if anybody wants to connect with me, you're most welcome. So think of a research topic, write a research question. It's not going to be your final research question. It's just the first draft. Develop concepts, elements central to your research topic. Refine your research question. Develop those lines we drew, relationship between elements, So you can draw them on a paper or on a computer screen, or you can draw them in your mind. How do different concepts, different elements relate to each other? And then again, research question is refined. And now based on this framework, design your research, develop a research design, your data collection method, analysis method. Think about which data collection method would be most useful at this for this research question with these elements connecting with each other in this way. And then ask yourself which existing theory might help you interpret your findings in full or in part. Right?
Yes, sir.
Yes. Somebody is saying something?
No, sir. Please continue.
All right. I can see a few familiar names on the screen, but I can't see their faces. All right. So once you have something like this, it will be easy for you to go back to the drawing sheet and change things if something is not fitting in the right place. Right? So if there are any questions, this is the time.
Yes, sir. I have got 10 questions, but I think we'll take it in the end.
Okay. So let's go towards conclusion. So first thing that we did, and which is very important to understand terminologies. A theory is an explanation of how or why something works, often developed through prior research and scholarship. It provides intellectual foundation for understanding a phenomenon. A theoretical framework draws directly from established theories to interpret and explain your research. It connects to your research, to your study, to existing knowledge. It connects your study to existing knowledge, offering a lens through which data can be analyzed and understood. Now, you see, when I'm writing it down, I'm writing theory and then theoretical framework, and then I'm coming towards the conceptual framework. But when we were explaining it, when we were discussing it, I brought the conceptual framework before the theoretical framework. Because you have to have a research idea developed into a research question to start thinking about the theoretical framework. And so a conceptual framework is built from concepts, ideas, and relationships relevant to your specific research question. This will organize variables and clarify how the variables interact, guiding the design and methodology of your study. And when we are talking about this theory and theoretical framework, including that theory, we are only talking about the pre-established scientific theories, right? The word theory is really confusing. It comes in a lot of ways, in a lot of places in research. So please be very careful when you're using the word theory or when you're reading the word theory, right? How do this apply in research? Conceptual framework makes the case for why a study is significant and relevant. Showing on the board which parts connects to where, how these are related, where is it taking us. The significance and relevance of your study will come out. It will help you identify and connect the relevant elements to the study and guide how the study design, including data collection and analysis method, appropriately and rigorously answers the research question. Okay, so this is what the conceptual framework does. Now, coming to the theoretical framework. Theoretical framework ensures that the study is grounded in existing literature and contributes to the body of knowledge. Right? So this is Although we were defining it before conceptual framework, but writing it after conceptual framework now again. Because this is what is giving your study that significance, that importance from the literature perspective. And at the end of it, you will ask the following question to yourself. Do the existing theory or theories about the concepts I have used in my study help explain what my data is showing in full or in part? Right? You have done your study, you have developed your research question, you did your data collection, your analysis, you've completed your study, you thought of a theoretical framework, probably you had some in mind at the time of proposal writing, and by the end of it, your theoretical framework is also established. And now you ask yourself, okay, is my theoretical framework explaining my results in full or in part? And many a times you will find, and this is something you will write in your discussion also. You must write in your discussion, because this is what is giving weight, is giving that impact to your study. You will find that some part of your data is explained by the existing theory that you have used to explain your research. And some part may or may not be explained by the existing theory. This is perfectly normal. There's nothing wrong with it. In fact, I would say it is good if all of your research is not explained by existing theories. So now you will combine existing ideas in a way that makes sense of your data and ideas coming from your research. So ideas coming from the theory and ideas coming from your research. You will combine them, and you might also develop new theoretical ideas. Remember, your speculations, scientific theory, together they help you in developing your concepts, your personal abstract ideas or principles, right? Some of them were explained by theories, some of them were not explained by theories. So the ideas which were not explained by theories, but you actually did research on that, and then you prove them that yes, this is something that can also happen. So whoever gave this theory did not see it from this angle. So you might develop a new theoretical idea coming from your abstract concepts that explains what's going on in a way that existing theories do not explain. And this is how your study adds to the body of knowledge, your meaningful contribution to literature. As in you may refine the theory. You may say, okay, this theory fits the idea in this context, but not in my context. Or you may say that, okay, this theory fits the concept, the ideas, as long as this is happening. But what is happening in my context, it does not explain it. So you are actually refining the theory, or you are extending it into your own setting, or you are in some cases building something genuinely new for your context. So this is how conceptual framework, which comes from your abstract principles, your abstract ideas, your concepts, which are developed, which are based on your knowledge and your experience and your speculations, connect with theoretical frameworks, the ideas which are already evidence-based and tested and proposed and published by different people. And this is how the two frameworks, turn your ideas into impactful research. In this way, when you ground your research in clear conceptual and theoretical frameworks, you don't just answer a research question. You build bridges between ideas. You bring new evidence into literature. And that is how health professional education research moves from isolated findings to meaningful and impactful contributions to the future of healthcare. theoretical framework, conceptual framework together to develop a clear design, research design, and meaningful insights coming out of your research. Thank you very much.
Thank you, Dr. Shamim, for your very nice and explanatory presentation. I would like to ask the participants, they can go with their questions. Yogesh message earlier while during your presentation, he was confusing some points. So I would like to ask Yogesh if you want to clarify your confusing point.
My thing was like all these years I thought theory was an established or proven thing. So today sir was talking about theory as what you think is a theory. So that confused me. What he was calling theory was actually a possibility, assumption, or hypothesis for me. But when that word is used, theory, it looks like it is a proven thing. That is how I see it.
So yes, Yogesh, that is exactly what I was saying, and you completely got the point that the word theory itself is very confusing for us as researchers when we start coming to this field, because the word theory is used in so many different ways. One way the theory is used is that theory that is already established and proven, the scientific theories, okay, published and accepted from ages or maybe new ones. Then the word theory is also used for your own concept. No, you say, in my theory, if I eat apple, I will become stronger. It may be as you may have your own idea about it, your own assumption, but you can call it a theory because it's based on your experiences. And then so when we are using the word theory, we have to be careful. Thank you very much for clarifying that.
So I would like to go to the first question that Ibrahim asked: how can we differentiate between theory, assumption, and hypothesis?
Yeah, so there are a few things which I deliberately did not touch in this presentation. One of them is hypothesis and assumptions. Another thing is a research paradigm. That is also something which comes from theory. Okay. And coming to the hypothesis, now hypothesis is not is your research question actually. When you have a research question or a research idea, you develop a hypothesis from that. Right. So it is not something which is pre-existing or based on some already developed scientific theory. It is hypothesis comes from your idea. So yes, if you're doing a say qualitative research and you develop a hypothesis, it can be a part or it can help you in developing your conceptual framework. Right. So hypothesis can become a part of your conceptual framework. But in social science research, and I'm a proponent of qualitative research more. So I use research questions rather than hypothesis. Yes, but if you're using hypothesis, if you're doing a quantitative research, then it can be a part of your conceptual framework.
Meher Afroz, you have got a question?
Thank you very much, Dr. Shahid Shamim. You have delivered a nice presentation and you have clarified the difference between conceptual framework and theoretical framework. My question is that when we develop research question and we describe the context and rationale and problem statement, so it was advised from our supervisor that give reference. We At this stage we talk about our concepts and what do you say our conceptual framework, but it was demanded from the supervisors that give a reference of this. So is the referencing essential to describe our conceptual framework?
Okay. So when you are explaining your conceptual framework and significance and rationale to your study is being written, your ideas, there is something I call the author's voice. Okay. Your ideas should stand separately or should be seen, should be able to seen and read separately from what you're putting evidence as a support to. For example, in the example that I gave, that educational input and patient outcome, right? If you write something like that I want to in my medical college, because we don't use our assessment is traditional and we are not using modern assessment, therefore maybe we are not able to produce good doctors, for example. I'm just thinking from the top of my head. Okay. And now this statement does not require, this is coming from your experience, this is a purely an assumption, your assumption. You do not need a reference to this statement. But if your statement is that it has been seen in different places that assessment, if the assessment in it this way, the outcome can be in some other way, that statement can be supported by evidence. And you can say that so and so also found this or has, or you put a reference to it that this is supported. So your supportive reference, your reference or your supportive evidence is for the statements that are coming from research, somebody else's research. But if you're talking about your assumption, if you're talking about your observations from your experience, then you don't need a reference to that. And usually when we are writing significance of a study, before that, a lot has already been usually written in the proposal or in the thesis about from which comes with references. So in our institute, we suggest to our students that your significance rationale should not have too many references. If there is a statement which requires an evidence or support, then you put it to there. But it should be more in the authors, on the researchers, or in the researcher's voice, rather than with somebody else's voice. But you can
Suppose
look up.
I want to know.
Suppose you want to, sorry.
Suppose I want to know about. Suppose I want to want to know about the perception of our faculty for faculty development need. So in my context, I will write that there is a lot of need. The faculty perceive that there is a need to such kind of faculty development program. So this is my assumption. This is my concept that faculty need this program, or this program. So
So for a
uh,
statement like this, if you're saying that in your experience, faculty needs this in your institute, what
so
is
does it need
this?
faculty?
What is this assumption based on? Is it based on your observation?
Observation based
Yes.
on observation.
Yeah. So if you just add into that sentence that based on my observation, uh, this is what I believe or the authors believe that the faculty needs, then you would not need a reference to that.
Okay, thank you. Thank you.
Ji Abdul Razak Saab, Assalamu alaikum. How are you?
Fine, thank you, sir. So my very good presentation. My question is that you, as I have understood that the theoretical framework, they change in the last, while we have made the results or data we have collected. And suppose I give you an example, moral distress in surgeons, suppose. This is a qualitative study, a phenomenological study, interpretative. And we start with the conceptual framework, and then in the last, we make interview questions. And how many theories should we inculcate? Rather, one like Jamieton's theory, or more than one theories there are reported in literature? Or one theory is sufficient? What do you think?
So again, it's not about how many are required or how many. It's not a checkbox kind of a thing, right? That you're not completing numbers. It's about if moral distress in surgeons is what is your approach to it? What is the angle that you are looking at through? What is the lens that you are looking at to this problem? For example, if you are uh, so right now, I am not aware of the theories of moral distress at this point in time. But when you read the theories, one of them or more than one of them will resonate with you, with resonate your idea of research. From where you are coming. As Meher was saying that in her context, she observed something, and from that the idea generated. So in your context, you observed something from which that idea generated. And when you read different theories, any theory that resonates with your idea may be applicable to your theoretical framework. It can be one, it can be 10, right? But
Oh,
if there are 10 theories resonating with your idea, then I think you need to focus your idea more, bring it
oh,
more narrow towards something, because that means it's going too broad, right? So
oh,
generally speaking, I would suggest it should not be more than two or three theories. I mean, even three would be, I think, because as many theories as you put in your theoretical framework, you have to explain them, or you have to explain your results in the discussion from the lenses used by those theories, right? So if it is maybe if it is a PhD thesis, then we can think about three or four theories being used. But for an article, I would suggest try to stay between one and two. Yeah,
thank you. Thank you.
thank you.
Sakin, if we have time, can we take a few more questions?
10 more questions. Wow.
I think it's
I would also invite Dr. Shamim to come maybe for a workshop on research in medical education or clinical education. Would you be open for that? I can work with
Oh,
you on
sure,
the
why
time
not?
and dates.
Workshop on research in medical education, huh?
Yes,
Uh,
I'll work
sure.
with you and
We
we
can
can
think
figure
about,
out.
yeah, we can think
Yeah.
about that.
Mhm.
Which aspect of medical education, or what is it something which is already planned or something, or
No, Dr. Shabi and I both thought about this the same time that we could invite you for workshops. So we do
sure.
have workshops, so we would love for you to come back. And it was very
It
interesting.
will be an honor for me to be with you in these workshops. Mr.
Perfect.
Ibrahim,
I hope the attendees would also appreciate it, that you come back and give us some more of your knowledge.
wonderful.
Extraordinary, Shamim, extraordinary. Thoroughly enjoyed it. This is what
Thank
is needed. This is Shavi Zaidi. This is what's needed. Pedagogy for doctors is an alien language. Like the times when we started working on medical education, people didn't know about these things. And research methodology is a totally alien subject. And that is why Sakina is right, that if you could come over and do a workshop for our attendees, we'll have selected number of people, say about 20 maximum, and we can do in 2 hours. Sakina will contact you for the details. And that I think would be extremely helpful, because there are lots of questions. I'm just looking at the chat box, and each question demands perhaps at least 10 to 15 minutes of your time. So it's not possible in this webinar, but maybe when you come back and workshop, we can select the people and then work out. Topic could be within this framework. You can choose the topic, and Sakina will help you in that. We'll provide you assistance. So compliments. Gohar Wajid left a message. You know Gohar Wajid very well. He left an excellent message. A superb presentation, Shahid. So congratulations and thank you. Over to Sakina.
Yeah, thank you. I think some of the attendees are excited about the workshop too. Brother Ibrahim, do you have a question or comment?
I just want to share some my reflection and just a quick question because I already been going through this in my master journey that integrating this conceptual framework in my thesis. And my couple of colleagues were very much panicked why we are, how can we just integrate it in this practice? But currently we see this is considering the research journey, the conceptualization, data collection, and itself the publication. It's a too long process. And when we integrate this conceptual and theoretical framework, I feel it complicate the thing, but the end of the journey, you can see your research would be more impactful when you do this practice. Again, thank you so much, Dr. Shah, for your fruitful words and your deep concepts. Thank you so much.
Thank you, Ibrahim. Thank you for the kind words. So when Sakina asked me, Ms. Sakina asked me about topic of research, and I thought about this topic, that the reason was that I myself learned about it very late in my career as a researcher. Maybe half of my research is published 15 years from now, probably are totally baseless from conceptual and theoretical perspective. So I feel that this is something that if we can discuss earlier, if somebody would have told me earlier, I would look into it and try to learn it before that. But this 1 hour webinar, maybe this is not sufficient. This is not enough for it. It can only give you a kind of an awareness of the topic. But I would really urge you and request all of you to go look up articles, books on this topic, especially if you are a serious researcher or writing a thesis. This is something that you should look into. And you will not be surprised that different researchers, different people who have written on this topic have difference of opinions also. So as somebody, I was talking to one of the researchers from a European country, and her opinion was that you should either have a theoretical framework or a conceptual framework. You shouldn't be having both in your study. Similarly, different people have different views about it. But don't listen to anyone. Don't listen to me also. Read yourself, find out, make up your mind. Because as a researcher, your concepts should be clear. Your conceptual framework should be, as I said earlier, it's a very personal thing to you. So develop a conceptual framework on conceptual frameworks for yourself. That would be a beautiful thing.
Perfect. I think
Thank you for inviting me, Dr. Hussain.
We have one more. Ehsan Bhai has a question,
Okay.
I guess. Ehsan Bhai?
Ji.
Ehsan Bhai, you are on mute if you're talking.
Hi. Excellent lecture, Professor Shamim. Really enjoyed it. We are old hat teachers who were taught in the way when we used to learn 33 branches of maxillary artery in the Gray's Anatomy. And so concepts have changed, but it was very good. And it gave an insight into a very nice couplet from your country who said, सवाल जिसका था ख्याल जिसका था मुझे ख्याल में मिला मुझे सवाल का जवाब भी सवाल में मिला मुझे. The integrity you have shown that everybody should actually ask themselves and see whether they are answering all the questions they have in their mind, and then compare and then have a research integrity rather than plagiarism and copy other people's research. Very good lecture. Thoroughly enjoyed it.
Thank you, Ehsan. Thank you very much for your kind words.
Thank you. Hussain, do you want to close out?
Yes. So, Dr. Shamim, thank you very much for your time, and it was really, really impressive presentation. And what you shared with your experience, I've got a same thought that being a researcher, I have done my MSc in EpiBio, and I have not been taught in detail about how to use the conceptual and theoretical framework for especially doing the quantitative research. So it was a really learning topic for me as well, and it was a really an eye opener. So thank you very much for your presentation. I have got a few questions, but I was just thinking that if you don't mind, can we just put it on our WhatsApp group, and if you got the time, you can just reply over there.
Sure, no problem.
That would be a
If
good
I
idea.
can answer the question, I will answer them.
Yeah, and it'll be a
Thank you.
good idea to have others chime in as well, so we can continue the discussion to our global e-learning platform. Perfect. Thank you so much. I really appreciate it, and I appreciate everybody else from joining. We will have another webinar in 2 weeks, and I will see you all then. And I will connect with you, Dr. Shamim, to talk about the workshop. So everybody, yeah.
Thank
I
you.
will
Thank
share
you.
the details as soon as we have it completed. Thank you so much. Appreciate your time.
So, Kenneth, do you have any question about the course that we're doing? There was a discussion because Dr. Sorabi is from Iran. Remember we talked about it? Do you think you could ask Shim?
Let me